Hello, I'm going to tell you about what I found regarding an association between visual acuity impairment in childhood and late adolescent psychotic experiences, along with my supervisors and collaborators as part of my PhD. You might be wondering what eyesight has to do with psychosis. There are some theories that these might be associated. The two most relevant theories for this are described on this slide. The first is that visual impairment might be a causal risk factor for psychosis. This has been described well in the protection against schizophrenia model. This model proposes that both perfect vision and congenitally absent vision protect against the development of schizophrenia and other psychotic illnesses, and that the risk is highest in people with moderate visual impairment in the middle of this curve. This is based on the fact that there are no reported cases of a person with congenital cortical blindness developing schizophrenia. That's despite the fact that congenital cortical blindness and schizophrenia should have shared risk factors. So it's possible that congenital blindness does provide some protective effect through its impact on cognition. The second theory is that psychosis and visual impairment might share an underlying neuropathological process. In terms of embryology, the retina is an extension of the brain. It develops from the same tissue. So it does make sense that any neuronal damage seen in illnesses like schizophrenia might also occur in the retina. Some studies have been done which use images of the retina like this one. They do tend to show that people with schizophrenia have thinner retinas on average than people without, so perhaps there is some common neuronal damage occurring here. For this study, I used data from the Avon longitudinal study of parents and children, which is a longitudinal birth cohort of just under 15,000 infants. Children remaining in the study had visual assessments at age 7, which included measuring visual acuity, and they had assessments again at age 11. They answered questionnaires designed to elicit psychotic-like experiences at ages 17 and again at age 24. As the study went on, some people dropped out, as you might expect, so that by the time the outcomes were measured, there were just over 4,000 people remaining in the study. And when people with missing data for one or more confounders were excluded, there were just over 3,000 people. We reduced the bias introduced or potentially introduced by missing data by using multiple imputation, which meant that we could include anyone who had a measure of visual acuity at age 7 and a measure of an auxiliary variable, which allowed us to predict the outcome result. Initially, it looked as though people with poorer visual acuity at age 7 had a higher odds of psychotic experiences in late adolescence, but following adjustment for confounders, the evidence for this was quite weak. However, at age 11, there was quite strong evidence for an association between poorer best-corrected visual acuity and late adolescent psychotic experiences, including after we accounted for some confounders such as childhood IQ and parental educational level. There was also strong evidence that needing glasses at age 11 and the combination of either needing glasses or having a below so-called normal visual acuity was also associated with psychotic experiences in late adolescence. In conclusion, we found some evidence that visual impairment in childhood is associated with late adolescent psychotic experiences, and we think this best fits with the hypothesis that visual impairment could be a causal risk factor for psychosis and therefore possibly a target for prevention strategies if further evidence is in keeping with what we found. It is also possible that visual impairment and particularly reduced visual acuity is part of a psychosis prodrome, but we think that that is less likely given the ages at which the exposures and outcomes were measured in our sample. I'd just like to say thank you very much to my supervisors and collaborators and to my funder, and thank you very much for listening to me.